Let's get started. I'm Tim Merriman with the Daily Yonder, and the folks who will be talking to you today, I'm going to start down on the far end with Dr. Roberto Gallardo from Purdue University. Next to him, Allison Davis from the University of Kentucky. Then Corianne Scally with the Metropolitan Housing and Communities Policy Program at the Urban Institute. And then directly next to me, Dr. Joy Moten Thomas from Fort Valley University Cooperative Extension Program. So we've heard a discussion of some of the elements that go into building stronger rural communities. So let's just start right there. And Joy, let's talk about some of what we think are the building blocks for building healthier economies and healthier rural communities.
Thank you, Tim, and greetings, everyone. Some of the things that I see that are key building blocks are simply this: having healthy citizens who have access to affordable health care, towns with strong educational systems that assist industry with having a skilled local workforce. I also see the need for a desirable mixture of affordable housing, which consists of also high-end rental and ownership. The fourth thing that I see that's critical is having a transportation infrastructure in place to support not only the residents, but also industry. And then my last key component is to have trained governmental leadership.
Anyone else like to chime in on that question?
Thank you. I will echo my colleagues' comments on housing. Housing is a platform for opportunity. Where you call home determines the quality of your water and your roads, where you shop, where you go to school, where your social network is, what jobs are available, how long it takes to get to important places, to work, to childcare, health services. When housing costs get too high, people begin to make critical trade-offs that can jeopardize their health. Since the rent and the mortgage are due on the same day of every month, people begin to shift around other expenses, paying less for food or skipping medical bill payments. They may even put off seeking necessary medical care. And finally, we know that having unstable housing undermines health and well-being. Losing your home, whether due to foreclosure or eviction, can kick off a cycle of deepening poverty and trauma. And so addressing the housing needs of rural communities is critical to rural health.
So I think there are four essential components. The first is infrastructure that creates a quality of life. And that can include anything from wastewater systems, water, utilities, broadband, housing, and for my particular area of focus is healthcare. In addition, I see a strong education base, not just for K through 12, pre-K, as well as post-high school degrees. An entrepreneurial mindset. A lot of our rural communities that have thrived have done so because they're willing to take on some risk and innovation. And then finally, leadership capacity, transparent, honest leaders who have the best intentions of their communities moving forward. There was a recent study that was completed by Robert Wood Johnson Foundation and Partners that asked 1,300 rural residents what are their top healthcare concerns, and they were substance use disorder, cancer, and access to healthcare. And certainly those three coexist together and can exacerbate the problem. So in rural places, it's incredibly important to have a healthy workforce. Industry, before they move into an area or before they expand, they do some significant research about the available workforce. They look at other statistics that might give some details about health. And so areas that have high rates of substance use disorder, have low rates of labor force participation, and immediately take those places out of running for economic attraction opportunities. In addition, a survey that we did, now it's a little bit dated, but we interviewed 1,000 CEOs of the fastest growing manufacturers in the United States and asked them, what is it that you look for when you think about relocating or expanding to a new location? And the first thing they said was broadband. Now, this was 10 years ago, 10 years ago, so it wasn't quite as prevalent as it is now, but even in rural areas, and my colleague's going to talk more about that, it's still an important issue. The second is access to a skilled workforce. And the third one is access to healthcare. So those issues like tax incentives and having an industrial site ready to go were just well trumped by these other really local infrastructure issues. So for me, healthcare and a healthy workforce is very much an economic prosperity issue. And we've seen those communities that have invested in that tend to thrive more than those that have not.
And so obviously, Chairman introduced the topic as well, but I believe that a key component today for rural prosperity obviously is broadband. It is now a quality of life issue. It's just not a luxury anymore or entertainment tool. It's a quality of life situation. The bottom line is there's a couple of reports that have come out that really clearly outline that rural digital potential is being held back. USDA published this Precision Ag study that found that if all these components were in place, precision ag techniques would add up to $47 to $60 billion per year to the U.S. economy. As well, the Amazon commissioned a study with the U.S. Chamber of Commerce. They found that rural businesses have not unleashed their digital potential either. If they did, they would generate 350,000 jobs over 3 years and more than $47 billion of impact to the U.S. economy per year. So I want to introduce to you two concepts today that go hand in hand with broadband. One is digital parity, and the other one is digital inclusion, of which I will talk more shortly. But definitely, broadband is a key necessity today for rural prosperity.
Thank you. And so a little bit of context. Rural America is 55 to 60 million people, depending on how you define it. So that's 15-20% of the population. So it's a significant portion of the population. From a federal policy point of view, it's also 2/3 of our county governments, 2/3 of our school boards, 2/3 of our districts, our utility districts. So there are all these local government entities that policy affects and where the rubber meets the road. So even if there were fewer people there, you still have those governments that federal agencies are interacting with. So that's a big consideration in my opinion. It's tremendously diverse in economy, culture, geography, and so some areas are doing better than others. And so I'd like to ask the panel to sort of chime in on what, for those areas that are seem to be performing a little bit better economically, what are the things occurring there that seem to be helping out and explaining that difference?
I think, Tim, I appreciate you mentioning the diversity in rural places. And I think just to get a sense, there's a map there that highlights all of the light shaded areas are rural places. And so they certainly take up a vast geography across the United States. And so we've seen rural places that are rooted in agriculture. We've seen rural places that are rooted in kind of extraction-based industry. And then we've seen some of those same places that have manufacturing as their main economic base. And so those places that tended to rely solely on one industry have, and not surprisingly, have struggled. And so those are the same types of places, the farming and mining and manufacturing. So those places that are rich in amenities and those places that have capitalized on those assets and those amenities have tended to do quite well. So on this slide, it's a little bit tricky to see, but it's important to know where those places are that have thrived, and they tend to be amenity-rich places. It doesn't necessarily mean that they have the most amazing climate. So the places that have fared the best have been Florida, the upper Great Lakes, which I think is a little chilly right now, and then the Pacific Northwest. And those are the places that have provided an experience and a quality of life for individuals to move to. So it's important to kind of see this map to understand what's going on here. So those places that are yellow, there are fewer people leaving over that time period. So that's a place that has accomplished something great. They've created a place where people would like to move. And so before there are fewer people who are leaving over the time period than the one before. In red, that's the one where we're most concerned. There are more people leaving, so there's an overall out-migration of individuals. Tend to see that kind of in the central part of the United States, some parts of the Delta and Appalachia. The green areas have high rates of in-migration, and so those are the places I've remarked. So even the Wyomings, the Montanas have been very attractive for individuals to move to because they provide great amenities. And then the light green are those areas where the county went from out-migration to in-migration. So they have done something that has made their place more attractive for people to move to. And people move to where there are jobs, so we can associate those two things together. Or they move to places where they can retire and they have access to the services that they need.
The only thing that I really wanted to contribute to Dr. Davis's points is that with regards to rural America, there's still something that rural America offers that Americans want. However, the challenge is, with regards to rural America, there's so many things that are just not going right. We're noticing that hospitals are closing. We're noticing that the education system there are some of the poorest. And I'm coming from an extension standpoint. I am located in Fort Valley, Georgia, Peach County, which is dead smack in the middle of the state of Georgia. And so my perspective is a little bit different because I'm in the trenches every day. So the question that we are poised with is that people want to be in rural America because of what it offers. It's a beautiful place. But if you don't have the amenities, the necessities that are needed for a quality of life, why should I stay? And so one of the key things that we're doing as an extension program is trying to improve the quality of life for citizens who make that conscientious effort to stay in rural America because it has so much to offer that metro counties just cannot compete with.
So this graph shows the percent population change by generation between 2010 and 2016. The orange bar shows counties with the lowest digital divide, and the green bar shows those with the highest digital divide. These are non-rural counties, not adjacent to metro, so these are the most rural counties. And as you can see, Gen Xers and Millennials are growing in these counties. So it's not necessarily, does not fit the narrative that, you know, they're losing population, which brings us to the broadband situation. Oh, okay. Well, I'll go ahead. Availability and adoption of broadband are two similar things, but they're not necessarily the same thing. So it's important to remember there is a lag. The rural is lagging urban in availability and adoption, but there are multiple factors for this. So here, this one to begin with, there's a quality of service. We are hearing more and more that some providers or some communities think they are well served, and I know that's hard to see, but the gray areas show census blocks with no providers at all. They're digital deserts. Look at the graph. On the top, it's the biggest share of those are in rural county or rural blocks. The pink one shows areas where only DSL was available. So DSL is copper technologies, is outdated, and so it's a quality of service issue that I want to kind of raise awareness towards, because many times they will tell you, oh, you have internet, you're fine. But the problem is, what internet do I have? What internet do I need? So that kind of shows quickly that rural is getting the short end of the stick in that regard. On the DSL front and on the digital deserts, overall there's 2.2 million housing units with no providers, and an additional 4.6 million with only DSL. Here at Purdue, we developed a digital divide index at the census tract level, but that's an example of a county level profile that kind of breaks it up in between two scores. One score looks at infrastructure, which includes median speeds and computing devices and people without access to 25.3. The other one is socioeconomic. There are indicators shown in the literature that kind of affect technology adoption. Of course, age is the number one driver of that. Income is another one. Disability, of course, is one. So this particular DDI is really helpful to jumpstart conversations. Those of us in the trenches, it's really hard to really explain the concept of the digital divide. So with this, it uses FCC data, so don't shoot the messenger. We all know all the issues with the FCC data, but at least it jumpstarts very important conversations, and it helps prioritize. So if the infrastructure score is way lower than the socioeconomic score, like in this particular county, then perhaps you've got to focus on digital literacy and relevance rather than infrastructure. Here are the by census tract. Those are the infrastructure quintiles. I know it's hard to see, but just so you can how it changes, that's the socioeconomic factor of the divide. That's the infrastructure. Notice how it changes. We cannot use a cookie cutter approach. And right now, federal policy is really going after infrastructure only. And there are other factors at play that need to be addressed. So that's kind of, overall here it's rural, the scores. Rural is, I believe, the bars all the way to the right. These are the average scores for each of those DDI components. You can see rural is higher on all fronts. But again, in my work, rural communities, rural households do understand the importance of broadband. Yes, ma'am.
Can I just ask, the socioeconomic score, so the higher it is, the more needs there are?
Correct. Not needs necessarily, but you're above average of the U.S., where on those specific indicators, that may indicate, obviously, that you may have to focus more on literacy and relevance. So you may have a higher share of older folks, poor or low income. So again, it kind of jumpstarts those conversations. I don't have much time to go into detail, but I'll be glad to expand on that. So basically what I'm trying to get at here is this digital parity situation where many states have approached me asking, how can we measure progress? And what I tell them is whatever you're building for urban, put a ratio and send that rural communities get that kind of 80% of what urban is getting. And just imagine if digital parity were a reality where in connectivity, skills, and mindset were equal, I think rural would be in a totally different situation right now. So what to do to address broadband access and availability? Let's increase quality of the service. Let's tackle affordability, and let's target homes that are more than likely to lack relevance. So these tend to be older. Specifically, age is the number one driver of the divide.
Thank you. Dr. Moten Thomas already mentioned the closure of rural hospitals as one issue. So talking more broadly about the issue of health, Dr. Davis, could you talk about some of the issues of health and how those interrelate with some of the economic and social issues we've been discussing?
Before I do that, I think Joy had something really important to say about broadband. It's good for this audience, okay.
And not to take away from the healthcare, but one of the things that I wanted to share, and I always emphasize that I'm talking from the standpoint of extension, is that when we talk about this broadband and access, do we sit here and we think about the cost of getting infrastructure implemented in rural communities? In the communities that I work with, they can't afford it. Earlier, Congressman Bishop mentioned that $6.5 million was put out there for USDA rural utilities. When you look at the maps that were up there earlier, how far will $6.5 million really get in the grand scheme of things? Can that really even help 2 or 3 states? When we look at the cost of broadband, the cost that is passed on to the consumer is quite high. And the concern is that now that households are looking at this as something that they want, but it's something that we cannot afford. On the flip side, when we want to attract industry into rural communities, one of the key things that they're looking for is broadband, but broadband is not there. So whose responsibility is it to ensure that rural communities have broadband? Nobody's willing to step up to the plate and answer that question. We as individuals, we look at the bills that we currently pay. We pay lights, we pay water, we pay gas, we pay sewage, we pay phone. do we really have any more disposable income available for broadband? In one of the communities that I serve, the way folks get access is they crowd up in the McDonald's parking lot or the Starbucks, and they get on their hotspots because that's the only way that they have access. Is that desirable? No. Local governments, at least the ones that I work with, are not willing to absorb the cost or even get into the utility business with regards to broadband. So in order for rural America to get a better grasp around it, something else is going to have to change. I don't know what that answer is, but I'm hoping by us dialoguing today that maybe we can walk away with something that will allow more communities, because 6.5 million is just not going to cut it.
Thank you. I think that's a really important message that needs to be heard. And I think another piece of that is the capacity of our local governments or applicants to actually do the paperwork and to understand what they actually need has been really challenging, at least in the communities I've worked with in Kentucky. On to healthcare, the next very optimistic moment. So I think we're a bit at a crisis moment right now. The entire system of healthcare is at risk, including hospitals, preventive care, obstetrics care, transport systems. And what we found is that rural residents really value having access to emergency care. And so we did this study several years ago and asked them, how important is it that you are close to an ER? And it was overwhelmingly important. And even if it was someone who'd never had to use it before, that gave them a peace of mind. If we think it just hits families, it's important for agriculture, for farmers, for accidents. It's just a really critical issue. So the freestanding ER concept, which has been introduced as a way to support those communities that have lost their hospitals, is interesting and has potential. But the way it's currently set up with the payer system makes it not particularly set up for success right now. It's set up so that if you have Medicare, you will not be able to use that freestanding ER. A lot of our rural communities, they serve elderly and individuals over the age of 65. Those are the ones who use those ERs the most. And so we haven't really created a system that I think is really useful at this point. Another interesting study that we just finished is looking at the impact of rural hospital closures on transport times. And so as you have these hospitals that continue to close across the United States, and the majority of them are in rural areas, some are in urban, and these results are not exactly the same for urban, is that when you close a rural hospital, your transportation time from the time they pick you up from the scene to the time they get you to the emergency room has nearly doubled. It was 13 minutes, depending on if you're elderly, over the age of 65, it has doubled. They say, some of the literature suggests that your risk of fatality has decreased if you can get someone to the ER in under 10 minutes. So now we're talking about 26 minutes. So we're actually really talking about the livelihood of individuals. The other piece to that is that no one wants to be a paramedic anymore. We don't pay a lot for this service. These are first responders that can get people stabilized for their 24-minute ride. And now, as an anecdote, Amazon has started hiring paramedics to work on their factory floors for twice as much per hour. So if we don't think that's a serious issue, we're in deep trouble, because if we can't get folks to the hospital, then I guess we don't really need a hospital to begin with. So the entire system is really quite challenging. So I serve as the director for the National Center for Economic Analysis for Rural Health. And certainly the purpose of that center is to document the economic ramifications from a hospital closure, including the loss of both healthcare as well as non-healthcare related jobs, the lower wages that we expect if the hospital leaves, and a lower economic tax base. And from the communities that we've worked in Kentucky and in the South, the loss of a hospital is typically going to be the last nail in the coffin for a rural community. So what can be done? Educating individuals about appropriate care, and recognize it takes time for culture to shift. So we've in past legislation that says that hospitals get dinged if people overuse the ER. We don't have individuals and rural residents that know how to access appropriate care. This is all they know. And so it takes some time to educate individuals about what appropriate care looks like, where to get it, and how to pay for it. In addition, create policies that support the unique needs of rural hospitals and providers. Right now, we treat everyone as they're the same. Identify recruitment strategies for doctors, for nurses, and other healthcare providers to serve rural places. This is obviously going to be a big issue as people age out of this career. And then improve relationships between hospitals and the community, so that individuals who live in rural residents don't immediately bypass their local health care to go to a larger city because they don't trust their local hospital. So those are my initial responses.
So what is driving the closure of these hospitals? I mean, declining population, or they're not profitable enough?
It is a combination of many factors. And so some of it is the payment system, some of it is declining population, some of it is poor management. A lot of our hospitals are run by city and county appointed individuals that don't know anything about running a hospital. And so it's poor management. But currently it is largely around how hospitals are compensated for care. And in rural areas, it treats a rural resident like an urban resident would use a hospital, and it's just not the same utilization.
So these hospitals, are some of them, have they been like long running and then they tank, or do they pop up and they pop up?
No, so these hospitals have been designated as critical access hospitals, and so they've been around for a while under this designation. That was back in the late 90s, I think. And so they've had the same payment system, but with changes in Medicaid reimbursement, with changes in uncompensated care regulations. Hospitals are getting lower payments in return for what they were in the past. But there's a group at the University of North Carolina that every year does a forecast for at-risk hospitals and looks at their financials. And I think right now, at least in the state of Kentucky, where we have about 130, we had about, I think, 37 that were at risk for closure based on financials alone.
Definitely access to health care is important and critical to health. But about 80% of an individual's health is actually determined outside of their access to healthcare services. Social determinants, there's a definition up on the screen. These are the conditions in which we are born into, we grow, we live, we work, we age, and then the wider set of forces and systems that really shape our daily lives. So there are a group of basic living and working conditions that affect our health. I think this has been a common theme across the panelists today. And these are, of course, things, if we're looking at that green arc, including food, education, work environments, and employment opportunities, basic infrastructure like water and sanitation, of course, those healthcare services, and then housing. And just as we have a rural hospital closure crisis, there's also a housing affordability crisis in rural America. 1 out of 4 rural renters pay more than half of their income for rent. And you can go ahead. We did a study recently to look at some indicators of demand and supply and affordability issues around rental housing in USDA-eligible areas of the country. And we found that in these places across almost 1,300 different counties, having a moderate to severe need for more affordable rental housing construction in those communities. Some solutions include better government coordination over housing programs that the federal government runs, as well as state and local governments, deeper capacity building in communities that don't have a thriving housing market and maybe haven't experienced new construction in quite some time and may not have the capacity and local developers to do so. And of course, more resources are needed to really try and level the playing field for rural Americans.
Another question.
Roberto, did you want to address?
She has a question. Yes.
You mentioned better government coordination. So I work for USDA Rural Development, and so we have housing programs, right? Are you talking about between, say, HUD and USDA? Are you talking about housing authorities? I'm not real clear. Are you talking about duplicative programs? What do you mean?
And repeat the question.
Yeah, so the question was just in terms of better government coordination, what did I mean by that? And was I meaning better coordination across federal agencies that have subsidized housing in rural communities, or if I was meaning something about duplication of services? I think what I mean when I say better coordination is acknowledging that we have two federal agencies that fund housing in rural communities, both struggling at times to try and make sure that those units are properly maintained, or that they're not, they don't face an expiring use or have their mortgage paid off and get lost. To the community, and some communities particularly that don't have other rental housing available or other subsidized rental housing available. And I think just greater coordination across all of that housing stock is really important for rural communities that deserve to have good access to their subsidized housing stock.
Hi, Robbie Boone with the Farm Credit Council. We coordinate a rural infrastructure coalition called Rebuild Rural. Thank you all for your time today. I actually have a question maybe for Roberto on your slide, related to your slide about millennial population growing, because that's, I think, important in sort of the demographic trends. Can you help? I just didn't understand the slide very well about, I assume the suggestion is in certain areas of the country specific to broadband, where there's a stronger broadband connection in rural areas, you're seeing population growth. And this, I apologize because it's back a little bit. It's slide 12 on the hard copy.
What the graph shows is by generation, right? But then each of the bars show the level of the digital divide. So the orange one is the lowest digital divide, and the green bar is the highest. So there are other factors at play. We were just trying to tease out. In fact, the name of this article that was published in the Daily Yonder is that Millennial vote with their feet when it comes to broadband access. And so this is the score on the DDI, the other metric I shared later. But I can explain in more detail. But what that shows is clearly that in those most remote rural counties that happen to have the lowest digital divide, there are other factors at play. Millennials were growing.
Okay, thanks.
Well, I'm going to read my statement because I don't want to get off track, and I know that I'm on a time limit. But when it comes to rural health, this is what I wrote. I says, nothing can be done to improve rural health if no one sees it as their responsibility. Whose responsibility is it to ensure that all citizens have access to affordable, quality health care? Whose responsibility is it to educate citizens about adopting healthy lifestyle? Extension is already at the table. How can a community survive without having a hospital within a reasonable distance from their citizens to from their citizens' doorstep? How do you attract highly trained medical professionals to rural communities to serve the needs of their citizens? Policies have to be put in place, and as we continue to see our elected officials debate this issue, there's still no avail. So what are we doing as Extension? We're promoting programs that provide a change in behavior. Because as Extension, we cannot make a hospital reopen. We cannot make a small minute clinic open. We're seeing that CVS and Walgreens and now even Walmart are opening up these little minute clinics as a possible option. But we as Extension, we are doing educational programs that are teaching our citizens about healthy eating behavior. We're teaching them to exercise. And we're not saying let's go and do boot camp. We're talking about just getting out and walk. We're giving our citizens pedometers just to count their steps. I think that's something that we do as individuals. And then the last thing that we're trying to do is we're trying to assist our farmers in increasing vegetable and fruit production in our state because we have way too many food deserts. We have people who cannot get fresh fruits and vegetables in their community, and that's unacceptable. It is not the medical community's responsibility to keep us healthy. There are some things as humans that we have to take into our own responsibility, and that's one of the key things that we're trying to do with regards to this health debate.
Thank you. And finally, I want to ask one more question, and I think this is significant for people who are working on rural policy and interacting with people who have ideas about what is going to be effective in rural. Every 3 months or so, the major editorial pages in the nation have comments to the effect of the money you're investing in rural America would be better spent in cities where actual jobs are created and where more people live and where the scale of impact is greater. You've probably heard that argument. So my question is to the panelists, would you like to respond to this idea that are we over-investing or spending our money in some kind of wasteful way when we invest in rural communities?
I'll take the first stab. I know we're running short on time, but I was just this week teaching my freshman Ag Econ students about the concept of a market failure. And a market failure is an economic situation that results in an inefficient distribution of goods and services in the free market. And right now, the rural economies are not in a free market. We are not in a free market solution. And what happens is that means that rural communities and rural residents don't have access to those things that are typically privately provided, like housing, like broadband, like health care. And so that then becomes the role of the government. That is the one and only role of government as an economist, is to be able to provide public services when the free market cannot come to a conclusion that is fruitful for everyone. And so I think while we might say that we federally subsidize rural Americans, the closest next thing to a private sector is private philanthropy. And I just want to show you this slide. Private philanthropy, I can't remember the exact numbers, but the percentage of private philanthropy money that goes to urban areas is about 95%. I don't remember, Corianne, if you remember, 93% goes to urban areas. So here's an opportunity where you have sort of this quasi, an entity that's not governed by anything, that doesn't have to provide public goods. And then when they are given an opportunity to support individuals and support communities, 93 cents of every dollar is going to an urban area. So I question if, in fact, we are over-subsidizing rural.
I think it's an interesting question, but I think the reality is that people in both cities and rural communities are struggling with a lot of similar issues. Accessing housing, getting a quality education, finding a living wage job, accessing childcare, getting medical health services that are needed. And I think it's really more helpful to think about trying to help everyone who needs it and how to find solutions that work for all people within the unique and diverse places that we live across the country.
And it's really kind of frustrating to see how mostly everybody applies an urban lens when they're analyzing rural. And they're two different things. There was this great article by Suzanne Anarde from Rural List. I'm going to quote her, "You've got absolute size of impact will not be the same in rural and urban, yet the quality of life impact or the meaning of that investment is really, really, really different." And so what she calls is we need to better understand rural economies and societies. We need a new scholarship for rural America. Only then will be in the right frame of mind to stimulate and deploy robust investments in rural America. So I don't know what the answer is necessarily, but we need to stop using urban-centric criteria or assumptions and apply them to rural communities. That will not get us very far.
So I'd like to thank all our panelists for their thoughtful responses. Thank you for your important time that you've spent with us. We have refreshments at your disposal, and that concludes the formal part of the program, and most of us will be around to talk to you one-to-one. You want to take, we have time for questions? Great. More? Okay. How much? All right. A couple questions?
5 minutes?
Yes.
Yeah, I have a question about when you're talking about broadband, if you're separating out, when you're talking about broadband, if you're separating out mobile broadband versus like in-home computer broadband. I believe there are areas that do have, like, you can have internet access in your home, but then you go out in the world and you don't have 3G or 4G.
Yes. So all the data I showed you is wired or wireline broadband. Wireless has one limitation. It's called data plans. And research is very clear. When you're using a smaller device, you are using the internet in a less productive way. It's clear. But the problem is many of these areas have to, because of the quality of services so not where they needs to be. They rely on their mobile data, cellular data, but the data plans will kill you. And if you have, teenagers in the house, if you're running your business, you will burn through that. And if you pierce through that ceiling, it'll be very, very, very expensive. So there is a big distinction between that. Another thing I want to kind of point out is 5G will not solve the digital divide. I get that all the time. It just won't. It will be deployed in urban, but it will not be deployed in rural anytime soon. So it's a very complex situation. But yes, we do distinguish between wireless, what's called mobile wireless, and fixed broadband.
One more question? Yes.
I'm really curious about, I can't remember which of you said that the needs in hospitals are different in rural areas versus urban. I'm just curious, how are the needs different and why?
Well, in most situations, rural hospitals are acting as a triage. They will not be doing surgeries. Their goal is to get people to have a heartbeat before they send them off to the next hospital. So they will not be able to charge for big, expensive surgeries. And the number of individuals who are using hospitals that are on Medicaid or Medicare are so much the larger share than if you look in urban, where they are more privately insured. And the limitations on Medicaid, particularly for rural residents, are really quite stymieing at this point in terms of being readmitted. And we have a lot of individuals. There's a hospital I was working with in Eastern Kentucky where one individual used the same ER in 1 year 300 times. So to ask this individual now we have created a system that should be a better way of maneuvering the healthcare system to have them figure out a way to have that culture change. That will not happen overnight. It will not happen within 2 years. And so we've set up a system for hospitals that if that person comes back in, the hospital doesn't get compensated. The hospital will not turn that person away. They've instituted all kinds of really innovative kind of patient navigators. So at discharge, they'll take the patient and try to figure out, why are you using this? But it's just a different culture of healthcare utilization in rural places.
Thank you very much, and please stick around and enjoy the refreshments.